August. The number of people getting vaccinated on a daily basis in our country is beginning to move up very quickly. The target at the moment still 300,000 people a day. Martin Kingston is the Vice President of Business Leadership South Africa. He, of course, has been working with Business for SA and government to get the vaccination process rolling. Martin, good afternoon to you. You've been working with government on this. We've now vaccinated, I think it's over 6 million people have at least one injection. The process is getting serious momentum.
That's absolutely right, Stephen. Good afternoon. We're seeing a very significant acceleration now in the number of people who are getting vaccinated. Indeed, over 6 million to date. We're going to be, we think, reaching 300,000 probably by the end of this week on a daily basis. We're actually targeting over 400,000 by the beginning of September. That's over 7 million a month and should enable us to achieve our objective of vaccinating the vast majority of the adult population before the expected fourth wave, which is what we have to do if we're going to be able to, make sure that we can protect people. And it's absolutely clear that the vaccines do exactly that. They protect people from serious illness as well as from death, and reduce the number of lockdowns that we'd have to endure as a consequence of any fourth and subsequent waves.
How many more resources do we have left to push into the process? It's easy to build up momentum. You get to a point, I suppose, of diminishing returns where it gets harder and harder to add more speed. Do we have the resources we need to hit 300,000 a day?
Oh, absolutely. We've already got enough installed capacity, in fact, to get to about 380,000. When I say we, I mean the public and the private sector. Public sector is already at 200,000 a day. The private sector is the balance. We see probably about 50-50 being provided by the private sector providers and the public sector. We have to remember that there's been great flexibility introduced by the minister and indeed by the president into the rules. Now, if you are insured or uninsured, you can go to a private sector facility or a public sector facility. You don't even need to have a scheduled appointment. In fact, even the registration process has been simplified. All of that intended to boost the number of people who can both register and get vaccinated as quickly as possible. The second issue is that we need to make sure that those in the more remote areas of the country get vaccinated as quickly and as effectively as possible. That's also being the subject of very significant scrutiny at the moment. The Solidarity Fund is pushing both for registration and access to that. We had a pilot project last month, or this month indeed, for SASSA grants. We're targeting 4 days at the beginning of August. We think we can vaccinate 400,000 people over those 4 days, primarily at retail stores when people go to collect their SASSA grants. So we see that ramp up continuing, Stephen, probably for the next couple of months until we get to steady state. The third thing is that we now have pretty much no constraints on our access to the vaccines, exactly as you said. Aspen is going to be producing and releasing today nearly 1.5 million doses of the J&J vaccine. We're getting approximately 1.5 million doses a week coming through from Pfizer, so no shortage of stock. And then the last point I want to make is, as the President also announced, from the 1st of September, we will be registering and vaccinating all adults over the age of 18. We think that will also boost and encourage those that are older than them to register and get vaccinated. So I'm very positive. We're now in the sort of top 10, 12 of the world at this stage in terms of the ramp up vaccination per capita. We think that we can do better than we've done to date. I know that many people felt frustrated that it was a slow start. In fact, it needed to be slow so that we could make sure that all of the teething problems were addressed. But I think that we will be very satisfied with the pace of the rollout from now on.
I mean, it's incredible how quickly it's picked up speed, how quickly people are talking about it. Is there anything that worries you that could put a little bit of a, you know, raise a little bit of a roadblock of some kind? I suppose still probably all of the problems would be overseas and getting supply. They wouldn't really be here now.
Well, I think the fact that, as I indicated, J&J is now manufacturing on the continent the first manufactured parts of the program is very good news, not just, by the way, for South Africa, but also, of course, for the rest of the continent. We are at the whim of the manufacturers at the end of the day. We've seen the same thing happening in Europe and in North America. The second is that there could be a variant that emerges. At the moment, we're dealing with Delta, but there are many people who are concerned about Lambda and future variants that could emerge. We don't know about the efficacy of the vaccines against them, but we're confident that with respect to Delta, both Pfizer and J&J have the right level of efficacy. That's the second issue. The third, of course, is that we cannot ignore, for example, the unrest that we saw in KZN and Gauteng over the past 2 and 3 weeks. That has resulted in very significant disruption, certainly in KZN. We lost about 20,000 doses of the vaccine. We had to reroute about 50,000 doses to other provinces. We've picked up speed again. KZN, in fact, was the best performing province in the country for a period of time. That was unanticipated. We need to make sure that it doesn't in any way interrupt the rollout. But beyond that, I think that all of the issues that we needed to address, Stephen, now have been addressed, and it is for us a perfect example of public-private sector cooperation. We are working literally hand in hand with the government every day of the week under structures that are overseen by the Department of Health, the Director General, with representation from Treasury and the Presidency. At the beginning of the mass rollout campaign, which was the 17th of May, we were meeting literally daily. Now we've throttled back to 2 or 3 times a week at that level, but our teams are meeting on a daily basis to deal with any issues. I'm confident now that we are certainly going to be able to see a much smoother process for all of the adults in South Africa, and I would encourage everybody to get vaccinated as quickly as they practically can.
It really is incredible how quickly this is moving. It's incredible to get some really good news in all of this, Martin. I do want to ask, you mentioned the rural areas. I mean, I'm presuming, for various reasons, private sector resources are concentrated in urban areas. That's where they're concentrating. The rural areas, in the end, are really going to be up to government, I presume.
Well, not exclusively. You're partly right. We now have an integrated model, in fact, a supply and demand model. It's worked on jointly by the National Department of Health and Business for South Africa, and that looks at where we can turn on and off capacity across both the public and the private sector. Predominantly, as you say, we're likely to rely primarily on public sector clinics and hospitals, but where we have pharmacies in rural areas, we certainly will be activating them to the extent that it's sensible and viable so to do. And of course, J&J is a much easier vaccine to administer, only 1 vaccine rather than 2, and much easier cold chain handling requirements. So we think that actually in the rural areas, the private sector can and should also play an important role alongside the public sector.
You talk about the partnership between government and the private sector in this. It's not always been an easy relationship, Martin, as you well know. Do you believe this is going to set some kind of foundation going forward? We're going to see it just easier for the 2 sectors to cooperate in the future?
Yeah, I think that there's been an extraordinary learning experience over the past 15 months, not just with the vaccination rollout program, but even with the likes of UIF TERS last year and indeed this year, the work we did importing PPE for the country, and indeed the economic recovery strategy that we put in place under the auspices ultimately of NEDLAC. That work is carrying on. We have built up a much higher level, I would like to believe, of both mutual respect and trust. And I think there's an acknowledgement on all sides that we need to harness all of the resources that are available and expertise in the public, in the private sector, amongst all social partners. And the proof of that pudding, in fact, has been in the eating here with the vaccine program, which has been and is proving to be now a very successful public-private partnership.
Martin Kingston, thanks very much indeed, the Vice President of Business Leadership South Africa. I do appreciate the time. Well.